You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
The testimonials appearing in this podcast reflect individual experiences and individual results may vary. Cardinal Health does not claim, nor should the listener assume, that any individual experience recounted in this podcast is representative of what another consumer may experience.
The Cardinal Health Counter Talk podcast, in collaboration with Pharmacy Podcast Network, is for independent pharmacists to learn about the state of the industry, innovative services and solutions, and the future of pharmacy. Join me, your host, Jason Callori, for conversations with pharmacists, Cardinal Health leaders, and industry experts, sharing best practices, discussing industry trends, and showcasing Cardinal Health products and services. You can subscribe to the Cardinal Health Counter Talk podcast on Spotify, Apple Podcasts, and wherever you listen to your favorite podcasts. Hello, everyone, and welcome back to the Cardinal Health Counter Talk podcast. I'm your host, Jason Callori, and in this episode of the Counter Talk podcast, we will be discussing two important topics in the world of independent pharmacy. That includes how to keep independent pharmacies independent and working collaboratively with others to drive profitability. Here with me to discuss it is Jeff Harrell, CEO of Cascadia Pharmacy Group, which includes 30-plus independent pharmacies located in the cities, suburbs, and rural communities of the Pacific and Intermountain Northwest. Cascadia Pharmacy affiliates are community-run pharmacies that collaborate to streamline operations, lower buying prices, and, of course, centralize services. Jeff, welcome to the show.
Hey, thanks for having me. I appreciate it.
So, real quick, just to kind of get the listeners to get to know you a little bit, tell us why you chose pharmacy as a profession and your journey to your current role as CEO of Cascadia Pharmacy Group.
Yeah, no worries. This will get a little interesting because it's probably not the normal why you chose pharmacy. Out of high school, I had kind of three things I wanted to do. I wanted to play basketball, you wanted to party, and you wanted to chase girls. and so I went to a junior college to play basketball. And after a couple of years, my mom says, "What are you going to do with your life?" I said, "Well, I'm enjoying this basketball and partying and the other part of things." And I said, "Well, what do you think?" She says, "I think pharmacy is a great profession. I'm reading about it a lot, and I think there's an opportunity there." And so I remember this very vividly. I made that phone call over to Washington State University and ended up getting a guy by the name of Dana Lowry, and then ended up visiting with a guy by the name of Keith Campbell, who's legendary there at WSU in the diabetes space. And long story short, I applied, got accepted after my junior college years, and went over to Washington State and started pharmacy school. And the interesting part is, at the time, Washington State basketball wasn't the greatest program, and I thought about walking on there, and then I'm like, I better focus on my education. And here we are today. So that's really how I got into pharmacy, I guess, thanks to mom. Mom reading, it was a good profession at that time, but I think that was 1994.
Mom knows best, doesn't she?
Yeah, in this case, she does. Yes, or she did.
So, how did you eventually end up creating Cascadia Pharmacy Group?
So that is something that just happened by chance. Right out of school, went back to my hometown in Long Beach, Washington, and I began working for them, and then looked to move up to the Seattle area after a year or so and work for Holly Whitcomb Henry. She had some opportunities in some stores there. So I managed a store for her for quite some time. And then it got to the point where I was like, I'm really enjoying the management side, the operations side, the cost savings, the implementation, the stuff that can really make a store profitable. And then I got a call, from my current partner that his sister wanted to sell out. And so we moved back from Seattle down to the coast and bought in 2006 to a 3-store chain, on the peninsula there of Washington State. And then in 2008, another store in our county popped up and they did that deal. And, I learned a lot each time I do a new deal. And then had a couple students come through, and Eric Nelson, who's one of my key partners right now, had a store penciled out in Spokane, and I just said, hey, I'm noticing as I'm adding stores and that I'm getting a better cost of goods. And I said, man, if you let me buy in with you, you're going to get some great benefits. And so Eric came on as a partner, and it just kind of has grown. And then probably about 6, 7, 8 years ago, I realized that, man, I if I'm staffing, number one, I'm so busy, I'm not doing a good job. And number two, if I get out of staffing and work on the pharmacy instead of in the pharmacy, that we could really take off. And so after I was able to get out of staffing and work on the business instead of in the business, things just kind of exploded, and just started finding partners. Bill Osborne in Oklahoma, he's a mentor of mine. His model was something that really appealed to me. And so we kind of followed his model for a while, but, like everything in life, you want to have your own flavor on things. And so, I kind of changed them all a little bit. And, like I said, I got a base cookie recipe, and whatever ingredients we add to that base cookie, we're going to get a different cookie, but at the end of the day, it's still a cookie. And so we, kind of followed his model, and then kind of have done our own thing. And then in the last couple of years, it's just exploded with the consolidation in the market, and owners that are aging out, stores that are struggling, that maybe just need some influx of energy and resources. It just started to happen, and we grew from 15 to 20 to 30. And then last year, I've been working on this for a while, but last spring I put together CPG, which is Cascadia Pharmacy Group, and it's a management company. And that management company, basically supports each pharmacy all the way from the buy side to the sell side, to accounts payable, accounts receivable, credentialing, HR, IT, marketing. We have a controller now. And all of that supports the back end of these stores, and it's allowed the partners and the managers to run the pharmacy, be the pharmacist, grow their business, take care of their community, take care of their patients, and not have to worry about all the red tape and BS that we have to do, to keep these stores running. And I made some key hires, and put together a team that I think is one of the top teams in the country. And here we are today at 39 locations, and probably have 10, 15 in the hopper at various stages, and it's exciting.
Well, so I would imagine if you're approaching a store, maybe to join, your pharmacy group, besides saving money, for cost of goods, what other, I guess, beacons of hope do they see when you knock at their door? What are those little bit of, those value added services that being in your group adds additional value to their store? Sure.
Well, and I heard you say I knock at their door. I don't have to knock at anybody's door, because my door is almost getting knocked down. I'm getting like 3 calls a week, and it varies, on opportunities for us and for them. I treat the seller probably a lot differently than others. I want it to work for them. I want them, oftentimes they've spent their whole career there. I want them to have, those glory years and right off into the sunset and happy. So I try to make it win-win. But what this has done is it's really allowed us to leverage. Cost of goods is obviously number one, but it goes down to credit card rates. We have annually, we're doing it twice a year. We're switching it to annually, where we now have our own vendor show. I got 20 vendors coming next month to our show, and taking care of us, and we take care of them. And it's also giving them resources financially. It's giving them, how many times does an owner not know the answer? Well, now we've got, 15, 20 partners plus the team at CPG. We've created a portal that they can go into that shows all these different ways that we buy, the processes that we do, all those kind of things. And so all of that cumulative, I can't put a price tag on it, but I can tell you right now that it's worth a lot for these stores. And it's why that, we have 39 stores and every single store is in the black.
Wow, interesting. Well, to get back to the business part of it, because you were talking about, getting from behind the counter and just, getting out of staffing, just being, a multi-store owner and really focusing on that. So how have your business priorities evolved as a multi-store owner over time?
Well, I'll tell you, it's been challenging, and I say that because when you are the owner and you are the pharmacist and you're there day to day, I mean, you don't miss a dime. I mean, you're dotting every I and crossing every T. But when you pull away and you start to work on it from a bigger picture, you have to accept that. And I wrote about this in the NCPA article that was released in January in the magazine. And it took me a while to accept that things aren't going to be done exactly or to the level that you would do it if you're on site doing that. And so once I got past that and started looking at a bigger picture and globally, I love that right now. So I'm negotiating contracts, I'm negotiating deals, I'm leveraging our volume, our size, our network. It's really allowed me to look at business from levels I never thought we'd be at, right? I mean, like the girls came to me that we hired for CPG. I got Crystal, Julie, and Tara, and they said, "Hey, I think we could put together a trade show." And I said, "You know what? There's no way. I don't want to do this. These are my partners. They don't want to pay money to be here and this and that." And they said, let us give us a try. I mean, we've got vendors that are waiting to come, spend time with us because honestly, they get 20 to 22 partners and they get an hour or two of their time. And that's hard sometimes for a vendor to get that. And so anyways, it's just stuff that's evolved it's kind of blowing my mind, but I love it. And it feeds me and it feeds the beast of our group. And I've got partners that are equally, invested and want to do this. And that's the key part. They allow me to be able to do this from a high level.
Yeah, for sure. I mean, I could just see the entire business model just taking over your mindset, which actually brings me to the next question, which is how are you encouraging collaboration between pharmacy locations, making sure all the patient needs are met? Because I would imagine if you have this network, you're kind of overseeing it, with your partners, you want to make sure that every single pharmacy in your network is servicing up to the levels that you expect, which is, I'm sure, is a very high level. So how do you manage those deliverables from store to store within your network?
No, you're exactly correct. As we get bigger, it's gotten harder. Like I said, chasing a bunch of cats versus a couple has made it difficult. But what we've done is really put in processes and procedures to streamline it for everybody. So same pharmacy software, same credit card processor, same vials, same labels, same e-recon, all the different processes. We keep all the stores as cookie cutter as possible. Now, with that said, each store has their own autonomy in their community. And so the patient doesn't know that, but it allows our pharmacists and pharmacy partners and managers to deliver that excellence like you represented referenced to the patient, but yet on the back end, keep it so that we're not, falling apart because, if I have every store doing their own thing, it just doesn't work, so IT, marketing, all those things, we even just did our new CDTA across the board. We now can test and treat 24 ailments in Washington State. Every store's is the same now. And so if we have a pharmacist that goes from one store to another, because we often share staff, we don't have any questions of what they can prescribe or what they can treat, through our CDTA. And so we've just streamlined those processes, and that has really helped allow us to grow and not, have all these different processes that could potentially pull you down.
So now that we've talked about, those goals that are happening behind the counter at each store, how has the collaboration helped CPG achieve their business goals?
That's probably the key thing. And I did a podcast for Pioneer a year or two ago called it's their Catalyst, but it was called the Pharmacy Matchmaker. I don't know how, what, where, when, and how, but the group of people that we have together are almost like family to one another, and that's how we treat it. And so collaboratively, I mean, we were just down at multiple locations for NCPA, and we had, several of us there. We collaborate so well, and I've got some of the most high-powered operators in the country, and together we share, we work our brains. Like we have our partner meeting next month, and we'll sit down and have a war room discussion on a Sunday and spend 4 to 6 hours of just where we want to go, what we're all doing, why it's working. And you hit the nail on the head. That collaboration is the absolute key to the success we're having. And also that how we get along, right? I mean, we work hard and we play hard, and that is huge to camaraderie, culture, all of that stuff. And so that we collaborate really well.
Yeah, I mean, it's the number one thing that pharmacies have at their disposal. It's connection, and whether that be with a patient or with each other, I think that just breeds good business and great patient care overall.
Yeah, for sure. It trickles down to the patient, right? I mean, if you got management and partners that are not seeing eye to eye, patients will feel that.
So, what advice would you give an independent pharmacy owner who is maybe considering getting into multi-store ownership? I'm sure there's a lot of layers to it, but if you can give just a little bit of advice, just from your viewpoint, what would that be?
I mean, the biggest thing, and the number one thing, and I've seen it multiple times, and I've talked to multiple people, is when you get to 3 or 4 or 5, 1 or 2, you can run them individually, but when you get to 3 or 4 or 5, you got to consolidate the admin. And you got to do that for all the stores. And once you do that, then it becomes a lot easier for you. And that way you're not doing this store this way, this store this way, this store this way, this store this way. All stores are being done the same, and you can consolidate that. And it's a leap, because people aren't used to hiring people to just do one job for, I got payroll or I got accounts receivable, and they're doing that. But the consolidation of the admin and centralize that, key, absolutely key.
So you reference your article in the NCPA, the National Community Pharmacists Association Digest, which you're the president. You've been the president since last year, correct?
That's correct. Yeah, I went on in October at the annual meeting.
So outside of the CPG group, you're involved in these industry associations, NCPA. I'm sure there's a couple of others, but how have your involvement in these associations, how has it helped enhance your work as an independent pharmacist and as a business owner?
So it's invaluable. I can't put a price tag on it. I can't put an ROI on it. I actually sit on the board of Align, our PSAO. I'm the chairman of the board of our buying group, AAP, NCPA president to get their 14-year track. Being plugged in to the industry and being on the boards with your peers, your colleagues, high-powered operators, different people with single stores, 200 stores, whatever that is, I get so much from that I can bring back to our group, and ideas. I mean, just again, I referenced it earlier, the multiple locations conference, which I think is one of the best independent pharmacy conferences right now going from, an ROI collaboration standpoint. I mean, I'm hanging out with 200 store owners, 100 store owners, 3 store owners, and the 3 store owners have just as good ideas as, the 200 store owners. And I mean, I have at least 6 items right now that we're really working on that are going to directly, affect the ROI of our businesses in a positive way. I just can't put a tag on it, Jason. I mean, there's so much good that I get out of that. Now, you're on the road a lot. You miss time with your family. There is definitely some sacrifices there, but it's insane how much I've gained from being on these boards and serving, that I've been able to take back and implement in our group.
Yeah, I would imagine it gives you some amazing insight to what other pharmacists are doing and learning from those pharmacists as well.
Oh, for sure. I mean, for sure. You think you're doing well, and then you go to one of these meetings and talk with others, and you're like, dang. I mean, like, for instance, I just give you an example. There's a couple pharmacies that are starting to look at AI bots to do their data entry, and they've got it down to 37 seconds of a bot doing refill data entry.
Wow.
And that just triggered my mind. It's like, holy cow, when we're in an industry where we're having trouble getting people to come to work, we're facing, increased employee costs, decreased reimbursement. If we can get a bot to run in conjunction on your pharmacy system, I think he said they're doing 387 or 400 scripts a day with that bot at 37 seconds and putting them on hold and ready to go. I mean, the pharmacist still has their place, but holy cow. I mean, what what a savings and where we're going. And so, just that one idea, I mean, if you can get that going and implement it across your pharmacies, just think about the time savings and the efficiencies you can have.
So obviously you're very passionate about Cascadia Pharmacy Group, for various reasons, but you're also really passionate just about keeping independent pharmacies independent. So how does one collaborate within these organizations with fellow owners as you work towards this goal to keep independence independent?
Well, you got to find. I mean, you got to find like-minded people like ourselves, and they're out there. I mean, this consolidation a little bit, although it's going to leave some pharmacy deserts and some access issues. I
Hmm.
do think that it's going to clean up the market as far as operators and like-minded people. I am, like you said, I eat, sleep, and drink, bleed independent pharmacy. I want it to be successful in these communities. We are the pillar of pharmacy. We are the premium product. I mean, what we give to our patients, our communities is premium. I've referenced that several times. It's the top shelf Pappy Van Winkle. It's the Japanese A5 Wagyu beef. That's us. And so what I really do is I'm an open book for people. You get my cell phone number, you get my email, and if you need help, reach out to me. Because I do the same. I ask, can I get your card? Can I get your number? I'm going to fly down and see a big chain. Fly down to where they're at and learn what they're doing. So I love the networking, but I really love helping. I mean, I want people to succeed. And I know sometimes that sounds crazy, from a financial standpoint, but if my partners are making a lot of money and they're giving back to their community, then the trickle down for everybody is a positive.
On that same note, what do you think, just from your viewpoint, I'd just be curious for the audience to hear this. What are some of the actions or some of the attributes you think today's independent pharmacies are helping establish themselves as vital community healthcare destinations? Obviously, we went through COVID. COVID, I think, definitely gave a little bit of a spotlight to the independent pharmacy. But now that we've come out of that a bit, and now we're looking at, obviously, we could talk about staffing issues, DIR fees, and a lot of those other challenges that independent pharmacies have today. What about just other things they should be doing to establish themselves, beyond all that?
No, you're exactly right. You know what? I don't even want to talk about that stuff anymore. The meetings that you go to and the negativities there, those aren't the meetings that you want to be at. You want to be at the positive meetings. I see a light at the tunnel. I actually see that lighthouse starting to brighten up for us. For those stores, you got to be doing everything. You got to be doing immunizations. You got to be doing compounding. You've got to be doing med sync. If you're not doing med sync, you're crazy. An idea that I just picked up at the last meeting I was at. If you could get your store to 65% med sync or more, you can actually close Saturdays and it's not going to affect your business one bit. So now you can worry about just staffing your pharmacy 5 days a week, 40 hours a week. You only need one pharmacist. You don't have to do shift changes, depending on your volume, just things like that. The other thing is you got to run it like a business. Unfortunately, the PBMs have pushed us to a point where the patient is somewhat of a commodity. And you have got to run your pharmacies like a business. If you don't run them like a business, then you're going to be struggling. And that unfortunately means you have to let patients go that aren't profitable for various reasons, or you got to do your best to flip that switch on them. But at the end of the day, you got to have your full book of business, delivery or mail or compounding. Clinical services is where CPG is hanging their hat right now. I'm developing it out. We are, probably, leading, I'd say, the country right now based off of the last meeting we presented there. We're doing some pretty good stuff. So you got to have a bunch of different colored eggs in your basket and all creating a revenue stream. And that is really the recipe for success that I'm seeing. Out in our area, the state of Washington, Oregon is recognizing our stores as critical access. So we have, the rural designation with CMS is 15 miles, which I think is going to get changed. And I think it's stupid anymore because, what signifies 15 miles? I got a store in Seattle that is only 7 miles to the next pharmacy, but it's a 40-minute drive. So it's like we've got to look at the patient access and the ruralness of the community and not necessarily a mile distance. but we're getting recognized as critical access, and critical access pharmacies are pharmacies that do things that other pharmacies don't, like the chains, the grocery stores. And when you stay open extra hours, bilingual, drive-through, med sync, compliance packaging, med monitoring, diabetes management, smoking cessation, all of that stuff, that's us. That's the premium product. And we're starting to get recognized and see a little bit of better reimbursement off that kind of cap labeling.
That's awesome. So basically fill that menu of services that you provide.
Fill the menu. Yep. I don't like to plug things, but it's a Cheesecake Factory menu.
That's a very large menu.
Yes, exactly.
Yeah. Well, I mean, last question for you. You kind of alluded to it earlier, right? When I asked you about, the steps independent pharmacies can take to help establish themselves. You mentioned, the lighthouse getting a little bit brighter. What do you envision right now for the future of independent pharmacy? Expand a little bit on that.
Well, we're definitely facing a GLP-1 situation, from a cash flow standpoint, from a compounding standpoint, a lot of that kind of stuff. We're also facing this reimbursement issues with the PBMs. I think you're going to see some legislation get through. NCPA is, on the cusp of getting this legislation through. It's bipartisan. It's supported by all. I think you're going to see that move the needle. I think you're going to see us go towards a little bit more of a cash-based model. With insurance getting so expensive, and we've got a bunch of people on high deductible plans that don't ever reach their deductible. I think you're going to maybe see, and I didn't come up with this. I got this, from Bill Roth, who spoke at the NCPA convention, and it made complete sense. Is you're going to start seeing, and you got the Cuban going, and you've got, Amazon, you got all these people trying, this cash base. I think you're going to see us pivot a little bit to cash base. I think the manufacturers might jump on it a little bit as well. So I think there's that. Obviously everything we just talked about, the different colored eggs in a basket, the menu, make sure you got your full menu. I think clinical services are going to continue to grow. And I think you're going to start seeing us paid to help out these, managed Medicaids and some of these payers where, they get incentivized for having high quality scores. And they're not doing a good job on their own. And so they need us pharmacists. And so I think you're going to start to see us get a piece of that pie and get paid, to do clinical services. I say you got to make 1.5 a pharmacist wage annually, or it just doesn't make sense. And so I think you're going to start seeing that come. That's kind of where we're headed.
Yeah, I mean, it's a lot, and I do appreciate the insight. You dropped a lot of great information for this podcast. I really appreciate it. And on top of that, I kind of want to go get Cheesecake Factory for dinner tonight. So thank you for that.
Well, you're welcome. I appreciate you guys. And anytime, I love what I do and passionate about it, as you guys probably can see. And I appreciate you having me, and anytime.
So with all that said, I want to say thanks to Jeff Harrell for joining us on the show to provide all we need to know about keeping your pharmacy profitable and all the different things that you can do to add to your menu. And to all of you, thanks for listening to today's episode of the Cardinal Health Counter Talk podcast. As a reminder, if this is your first time listening, make sure you subscribe and download the Cardinal Health Counter Talk podcast wherever you get your podcasts. See you on the next episode, and take care, everyone.